You have knee pain, and you also have back pain. Maybe you treat the two separately. One medication for one exercise for the other, one appointment here, another one there. Maybe you have even accepted that this is just how it is, that age is charging you for both at the same time. But what if I told you these two problems are not a coincidence, that there is a connection between them that most people have never heard of, and that as long as this connection is ignored, the pain simply will not go away? This is something I see every week in the clinic. People who had done everything for their knee and still kept feeling pain. Until someone looked at the full picture. And then things started to change. I have been a physical therapist for more than 10 years, and today I came to show you this connection, and 5 exercises that work on both problems at the same time. And stay until the end, because in the bonus, I am going to show you a simple test you can do right now at home, and it will tell you whether the two are really connected in your case. Let me explain it to you in a simple way. Think of a tower made of building blocks, the kind children stack up. When all the blocks are aligned, the tower stands easily. But if one block in the middle shifts out of place, the ones above and below start compensating. The tower becomes crooked, and any pressure on it goes straight to the weakest point. Your body works exactly like that. The lower back, the hip, and the knee are blocks in this tower. When the lower back loses alignment, which happens a lot after 60, especially in people who spent years sitting, the hip compensates. And when the hip compensates, the knee receives a load it should not be receiving. Not all at once, but little by little, day after day, until it starts to hurt. And what keeps these blocks in place? The core. Not the belly, the deep muscles that wrap around the spine from the inside. When they are weak, the tower starts to wobble, and the knees are the first to feel it. Studies confirm this connection. Pelvic misalignment is directly related to increased pressure on the knee. This is not theory, it is biomechanics. Tell me here in the comments, do you feel pain in both at the same time, in your lower back and in your knee? And had you ever thought there could be a connection? I read all the comments and reply, and that helps me better understand how I can help you. We know that wear and tear in the spine and knee also cause pain, along with the muscle loss that happens as the years go by, especially after 55. This has a name, sarcopenia. We have already talked about this in other videos here on the channel, but today I want you to leave here understanding that our body is interconnected and that we should look at it with care. Your posture and the health of your spine may be influencing pains you never imagined could be related. Pay attention to the exercises we are going to show now. I will explain each one in detail and the right way to do them. They can make a bigger difference in your life than you might imagine. Oh, before starting the exercises, let me tell you one quick thing. In the first pinned comment, you will find 2 tools that can speed up this process. An exercise program to follow at home at your own pace, and a natural supplement to support joint health. Take a look when you finish the video. Now, let us get to what matters. Exercise 5, Wall Cat-Cow. Let us start by mobilizing the spine, because before asking it to stabilize, it needs to move well. You have probably already seen this exercise being done on the floor on all fours. But since we are also thinking about the knee, we are going to do it standing up, with your hands supported on the wall or on the back of a chair. Same benefit, with no load on the knee. To do it, you will stand about 2 steps away from the wall. Lean your torso slightly forward and place both hands on the wall at shoulder height. Your arms stay extended and your body forms a diagonal line. Now, the movement happens in 2 phases. In the first, the cat, you arch your back upward like a frightened cat. Your chin moves toward your chest, your belly button rises toward the ceiling, and your lower back rounds. Hold for 2 seconds, feeling your spine stretch. In the second phase, the cow, you reverse everything. Your belly moves down toward the floor, your chest opens, and your lower back gently arches downward. Hold for another 2 seconds. One phase naturally leads into the other. It is fluid, like a wave traveling through the spine. I need you to pay attention to something I see happening a lot. the movement being concentrated only in the lower back, with the upper back completely still. Try to mobilize the whole spine, from the neck all the way to the tailbone. It is a completely different feeling when it truly happens. 2 sets of 10 repetitions, breathing calmly. Exhale in the cat, inhale in the cow. You can do it every day, including before the other exercises as a warm-up. You will see how you will feel relief in your spine and a sense of well-being. Now let us move on to number 4, where lying down, we start working the core from the inside out. Exercise 4. Core activation with leg raise. Now you are going to lie on your back on a mat or on the bed. Knees bent, feet flat on the floor, hip-width apart, arms relaxed alongside your body. Before any movement, I want you to find your core. Place one hand on your belly, below your navel. Now, as you inhale, you are going to fill your lungs and let your belly relax, and you will feel your hand rising. Now, as you exhale, you are going to make a gentle contraction in your abdomen, as if your belly button wanted to touch your back. This is not sucking your belly in with force. It is a gentle, deep, almost discreet contraction. When you find this activation, you will feel a slight firmness under your hand. This is the muscle we want to wake up. Now, maintaining this activation, you are going to release the air slowly, and as you exhale, lift one knee toward your chest, only up to hip height. Slowly, with total control. Hold for 1 second up there, and lower it calmly as you inhale. When your foot touches the floor, repeat on the other side. The secret is in the breathing. The exhale is the moment when the deep core naturally activates more. That is why the movement rises with it, not against it. If you feel your lower back lifting off the floor during the movement, it is a sign that the core has lost control. Reduce the range of motion. You do not need to lift so high. What matters is maintaining stability. You will notice that it seems simple, and in the first repetitions, maybe it will be. But as the core starts to get tired, maintaining control becomes more challenging. When you start to feel that, you are in the right place. We are going to do 2 sets of 10 repetitions on each side, with 30 seconds of rest between them. Now let us move on to number 3. We stay lying down, but the core challenge is going to increase. Exercise 3. Dead bug. Stay lying on your back. This exercise has a funny name, dead bug, which in Portuguese would be something like inseto morto, and it makes sense when you see the starting position. You are going to lift both knees until they are at 90 degrees, with your thighs pointing toward the ceiling and your shins parallel to the floor. Your arms stay extended upward, pointing toward the ceiling. This is the starting position. Before you begin to move, do the same activation we learned in the previous exercise, that gentle, deep contraction below the navel. Your lower back should stay pressed against the floor, and your belly button should always feel like it wants to be drawn in as you exhale, as if it wanted to move toward your back. Now the movement. You are going to lower one arm toward the floor behind your head, while at the same time extending the opposite leg, taking your heel toward the floor. Right arm and left leg together, or left arm and right leg. Go slowly, without rushing, without touching the floor with your heel or your hand. Hold for 1 second and return to the starting position. Then switch sides. I need you to pay attention to 2 things. The first is your lower back. It cannot lift off the floor at any moment. If it does, it is a sign that the core has lost stability. Bend the knee you are extending a little more and reduce the range of motion of the arm. The second is your breathing. Exhale as you open. Inhale as you return. Never hold your breath. Do 2 sets of 8 repetitions on each side with 30 seconds of rest. It may not seem like much, but when done with real control, it is already enough to truly feel the core working. Now let us move on to number 2. We leave the core and go to the glutes, and you will understand why they are the missing link in this whole chain. Exercise 2, glute bridge. We continue lying down, and now we are going to complete the cycle of the chain I explained at the beginning. Remember the tower of blocks? The core stabilizes the lower back, the glutes stabilize the hips, and when both work together, The knee finally stops receiving the load that was not meant for it. You are going to lie on your back, knees bent, feet flat on the floor, hip-width apart, arms relaxed alongside your body. Before lifting, squeeze your glutes. Do not lift first and squeeze afterward. Squeeze first, and let the hips rise as a consequence of that contraction. This order is what separates the exercise done correctly from the exercise done on autopilot. Lift until your body forms a straight line from the knee to the shoulder. Hold for 2 seconds up there, feeling the glutes firm up and lower slowly, vertebra by vertebra, without dropping. Now there is one detail I want you to add here, and it connects this exercise directly with everything we worked on before. While you are up there, maintain that gentle core activation we learned in exercise 4. Glutes contracted, core activated, lower back stable. When the two work together in this position, you are training exactly the pattern your body needs in everyday life. I need you to pay attention to one thing. If you feel the work in your back or in the front of your thigh instead of in your glutes, bring your feet a little closer to your body and start again. Do 2 sets of 12 repetitions with 30 seconds of rest. When it becomes easy, progress to 3 sets of 15. Now let us move on to number 1. We leave the floor, stand up, and put all of this into practice in a movement you do every day. Exercise 1, sit to stand. We have reached number 1, and this one is my favorite. Not because it is the hardest, but because it is the most honest. Everything we have worked on so far, spinal mobility, core activation, glute strength, will show up in this movement. And this movement is something you already do dozens of times a day without noticing. Getting out of bed, getting out of the car, standing up from the couch. When this movement hurts, all of life becomes harder. When it stops hurting, you regain a freedom you may not even have realized you had lost. To do it, you are going to sit on the edge of the chair, feet flat on the floor, hip-width apart. Cross your arms over your chest. Now, before standing up, do that gentle core activation we learned today, that light, deep contraction below the navel. It needs to be present throughout the entire movement. Lean your torso slightly forward, but with your spine aligned, not rounded. Think about bringing your chest forward, not your neck. Squeeze your glutes and push the floor with both feet. Rise slowly without jerking. When you are standing, stay steady for 1 second. Now, the most important part, lower yourself back down to the chair while counting 4 seconds. Slowly, with total control, as if you were landing. Do not drop, land. I need you to pay attention to 2 things. The first is letting your knees collapse inward during the movement. This is a sign that the glutes are not working as they should, and it puts harmful pressure on the knee. Your knees need to point in the direction of your toes the whole time, on the way up and on the way down. If you notice they are collapsing inward, place a mini band just above your knees. It will automatically activate the gluteus medius and help you maintain alignment without even having to think about it. The second thing is posture. The torso does lean forward, yes, but the spine remains aligned. Do not round your back. Do not push your neck forward. The hinge comes from the hips, not from the spine. Start with 2 sets of 10 repetitions. When it becomes easy, add speed on the way up. Rise quickly, lower slowly. This combination trains the muscle power that everyday life demands. Before getting to the bonus, I want to tell you something. You have just done something most people never do. You stopped, paid attention to your own body, and worked muscles that were probably asleep for years. That is no small thing, but the body has an interesting characteristic. It responds to what you do frequently, not to what you do once. 1 session changes nothing. 100 sessions change everything. And the distance between those 2 points is smaller than it seems, because you do not need a lot of time or a lot of effort. You need consistency. My suggestion is simple. The wall cat-cow can become part of your morning every day. It takes 2 minutes and prepares the spine for everything that comes next. The other 4 exercises work well 3 times a week on alternate days. And the sit to stand, You already do this dozens of times a day. The difference is doing it with intention, core activated, knees aligned, controlled landing. Turn an automatic movement into training without needing any extra time. You will notice the difference first outside the workout, in a moment when you stood up without thinking about your knee, on a staircase that felt easier, on a morning when your lower back was not so stiff. Pay attention to these moments. They are proof that it is working. I promised a test at the beginning of the video, and the time has come. This test is simple, quick, and it will give you information that few professionals stop to check. It reveals whether your pelvis is tilted too far forward, which, as I explained today, may be increasing pressure on your knee without you realizing it. To do it, stand with your back against the wall, heels, buttocks, back, and the back of your head touching the wall. Now, place one hand on your lower back, between your back and the wall. What do you feel? If only the thickness of your hand fits, the space is within normal range. If your whole hand fits easily, or if you feel that your lower back is very arched, far from the wall, this is a sign of excessive anterior pelvic tilt. In simple language, your lower back is arching more than it should, which changes the alignment of the entire chain below it, hips, knees, ankles. Now try this. Without taking your back off the wall, try to gently bring your lower back closer to it, as if you wanted to flatten your back. Do you feel your abdomen activate? Do you feel your glutes firm up? That is exactly the alignment today's exercises are training your body to maintain. If the test revealed excessive space, do not panic. It is information, and information is the first step toward change. The exercises we did today exist exactly to correct this over time. What you learned today is not a recipe, it is a perspective. The body is a chain, and when you start seeing it that way, you start asking different questions. Not just what is hurting, but why is it hurting? And that change in question changes everything. That said, if your pain is intense, if your lower back or knee is inflamed, if something has recently gotten worse, do not try to solve this alone. A doctor will give you the right diagnosis. A physical therapist will help you move safely again. Not because you are not capable, but because you deserve an assessment that is only yours. Now tell me something in the comments. Before this video, did you already suspect that the lower back had something to do with the knee, or was it a complete surprise? I am curious to know. In the first pinned comment, you will find 2 tools that can speed up this process: an exercise program to follow at home at your own pace, and a natural supplement to support joint health. Take a look when you can. If this video made you see your body in a different way, share it with someone who also needs to hear this. And subscribe to the channel to continue this conversation. Until the next video.